This multivitamin and iron product is used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important building blocks of the body and help keep you in good health. It is important to take this medication as directed by your doctor. Typically, it is recommended to take 1 tablet daily with food or as directed by your healthcare professional. Taking it at the same time each day will help you remember to take it. When taking Spectravite Adult 18 mg, 400 mg tablet multivitamins, it's best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all directions on the product package and not to take more than the recommended dosage. This medication is best taken on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless your doctor directs you otherwise. If you experience stomach upset, you may take this medication with food. It's important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. Be sure not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, it's important to swallow them whole and not to crush or chew them. Taking this medication regularly at the same time each day will help you get the most benefit from it. Remember to consult your doctor or pharmacist for details specific to your particular brand of medication. Some common side effects of Spectravite Adult 18 mg, 400 mg tablet multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to contact your doctor or pharmacist. The iron in this medication may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it's because they believe the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it's usually recommended to take it with a meal to help with absorption. The daily dosage will vary depending on your age, gender, and specific health needs, so it's important to follow the directions provided by your healthcare provider. It's important to keep Spectravite Adult 18 mg, 400 mg tablet multivitamins out of reach of children, as accidental overdose of iron-containing products can be fatal in children under 6 years old. If an overdose does occur, seek medical help immediately or contact a poison control center. Before taking Spectravite Adult 18 mg, 400 mg tablet multivitamins, it is important to inform your doctor or pharmacist about any allergies you may have to its ingredients. This product may contain inactive ingredients that can cause allergic reactions or other problems, so be sure to discuss this with your pharmacist. It is also important to discuss your medical history with your doctor or pharmacist before taking this medication. This includes any history of iron overload disorder, alcohol use/abuse, liver problems, and stomach/intestinal problems. If your multivitamin brand contains folic acid, be sure to inform your doctor or pharmacist if you have vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia, which can result in serious nerve problems. It is important to consult your doctor or pharmacist for more details. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it is important to consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Spectravite Adult 18 mg, 400 mg tablet multivitamins. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's best to separate your doses of these medications as far as possible from your doses of Spectravite. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are taking this drug. Remember to keep a list of all the products you use and share it with your doctor and pharmacist, and do not start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose and the person is experiencing severe symptoms like loss of consciousness or difficulty breathing, call 911 immediately. Otherwise, reach out to a poison control center for guidance. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Spectravite Adult 18 mg, 400 mg tablet multivitamins, it's important not to share it with others. Make sure to attend all your medical and lab appointments as recommended. Some brands of this multivitamin may also contain docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. Remember that Spectravite Adult 18 mg, 400 mg tablet multivitamins is not a replacement for a healthy diet. It's always best to get your vitamins and minerals from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. As for the optimal timing, it's important to take this multivitamin as directed by your doctor. If you are taking Spectravite Adult 18 mg, 400 mg tablet multivitamins on a prescribed schedule and miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. It is important to take this medication regularly to get the most benefit from it. Make sure to store Spectravite Adult 18 mg, 400 mg tablet multivitamins at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain, unless you are specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.